I am a fourth generation Cephalosporins. My generic name is Cefepime with a brand name of Maxipim, and this is my chemical name. I am classified according to my therapeutic and pharmacologic effect. Therapeutically, I am classified as semisynthetic third or fourth generation cephalosporin. Pharmacologically, I am classified as antibiotic and anti-infectives. Animal production studies have failed to demonstrate a risk to the fetus, and there are no adequate and well controlled studies in pregnant women, so I am in category B. So, I am going to discuss about how I affect the human body, what the body do to me, what am I used for, my contraindications, my side and adverse effects, and what the nurse do to me. My mechanism of action. I am a bactericidal and have the same mode of action as other beta-lactam antibiotics such as penicillins. I disrupt the synthesis of the peptidoglycan layer of bacterial cell walls. The peptidoglycan layer is important for cell wall structural integrity, especially in gram-positive organisms. The final transpeptidation step in the synthesis of the peptidoglycan is facilitated by transpeptidases known as penicillin-binding proteins. Pharmacokinetics. Following intramuscular administration, I am completely absorbed with an absolute bioavailability of 82.3%. My serum protein binding is approximately 20% and is independent of its concentration in serum. I am metabolized to NMP, which is rapidly converted to the N oxide. I am eliminated principally via renal excretion with an average half-life of 2 hours and total body clearance of 120 ml per minute in healthy volunteers. I am also excreted in human milk. Indications. I am active against gram-negative and gram-positive organisms, including cephalosporin-resistant staphylococci and P. aeruginosa. Contraindications. I am contraindicated to patients with known immediate hypersensitivity reactions to me or other cephalosporins, penicillins, or other beta-lactam antibacterial drugs. For CNS, I can cause headache, pain, fever, paresthesias, and lethargy. For cardiovascular system, I can cause phlebitis. For GI, I can cause colitis, diarrhea, nausea, vomiting, oral candidiasis, anorexia, flatulence, and pseudomembranous. For GU, I can cause vaginitis. For skin, I can cause rash, pruritus, urticaria, and for others, I can cause inflammation. Nursing responsibilities. If you were a nurse, you should be aware of these responsibilities before, during, and after administering me to your patient. So, before my administration, you nurses should perform a thorough physical assessment to establish baseline data before beginning your patient's therapy to determine effectiveness of my therapy and to evaluate for occurrence of any adverse effects associated with my therapy. Determine your patient's history of hypersensitivity reactions to me or to penicillins or to other drugs. Perform culture and sensitivity tests before giving my first dose if appropriate, and inspect my solution visually for particulate matter before administration. During administration, monitor injection site for pain, swelling, and irritation. Report prolonged or excessive injection site reactions to the physician. For IV administration, follow manufacturer guidelines closely when reconstituting me. Variations occur in constituting me for administration and depend on my concentration required and how I may package. Type of diluent used for constitution varies, depending on products used. Use only solutions recommended by manufacturer and administer the resulting solution over 30 minutes. Intermittent IV infusion with a Y-type administration set can be accomplished with compatible solutions. However, during infusion of a solution containing me, discontinuing the other solution is recommended. For IM administration, constitute me using sterile water for injection, normal saline solution, D5W, 5% or 1% lidocaine hydrochloride, or bacteriostatic water for injection with parabens or benzyl alcohol. Follow manufacturer guidelines for quantity of diluent to use. Use glucose test based on enzymatic glucose oxidase reactions, as a positive direct Coombs test may occur during treatment. Check PT and monitor renal function. Watch for seizures. Notify physician immediately if patient develops or increases seizure activity. After my administration, you nurses should instruct your patient to report any adverse reactions promptly, such as signs of superinfection, including black, furry overgrowth on tongue, vaginal itching or discharge, and loose or foul-smelling stools. Evaluate your patient understanding on my drug therapy by asking him or her to name me, my indication, and my adverse effects to watch for. Monitor patient compliance to my therapy.